As an expert on bipolar disorder, as well as someone that's lived with the illness for close to 17 years and an author of the new book, Beating Bipolar, people often ask me, what is bipolar disorder? There are lots of people out there that don't really know exactly what it is and are curious what it means to have bipolar disorder. And I kind of tell them that it's most simply like a seesaw, that people with bipolar disorder have manias and depressions. And the average person that does not have bipolar disorder does have different moods. Sometimes they're happy, sometimes they're sad, sometimes they're excited, sometimes they're slightly depressed. And that's very normal. We all have moods that go up and down, kind of like a seesaw. But people with bipolar disorder, also known as manic depression, have it to more extreme levels. They have manias that can be very problematic, that can affect their school, that can affect their jobs, that can affect their thinking, that can affect their relationships, and the manic episodes can be very severe and very damaging to their lives. They also can be depressed and they can have issues like not getting out of bed, not wanting to work, not wanting to be around the people that they're closest with, and even committing suicide. There are statistics that say 1 in 5 people with bipolar disorder will commit suicide in their lifetime. And that is a horrible, terrible statistic that I hope we can one day lessen as we get more education and knowledge about bipolar disorder. But the main thing to know is the people with bipolar that are untreated usually swing from manias to depressions, and it can be very difficult to live this way and to have this in your life. It's often very troubling for the people around you. I mean, just imagine if you had a friend or a boyfriend or a girlfriend, husband or wife, or son or daughter that one minute was okay, normal, happy, having a good day, and the next minute they're talking like this 100 miles an hour and they're moving really fast and they're like, oh my God, what am I going to do? And their brain is really thinking so quickly and they're, running around doing kind of activities that you wouldn't normally expect them to. That can be very difficult. And then all of a sudden, an hour later, they're depressed. And the thing about bipolar disorder is it affects everyone differently. There might be some people that mostly only get manic symptoms. They can stay up all night, not sleep at all, do things, running around, speaking really quick, and that's the majority of how they have their bipolar disorder. Other people swing more towards depressions. They're more depressed and they only have what's called a hypomanic episode, which means that they're slightly manic, but never to the case of full-blown mania. So there are very different types of spectrums and levels of bipolar disorder, but the most important thing to know is that if you might have it or someone you know has it, it's important to get treatment and to become educated about it, because it is a very treatable disorder that people are living long, successful, healthy lives for. There are therapies out there, there are medications. I'm a bipolar coach. In my practice, I work with people to teach them how to understand what bipolar is, how to work through it, how to handle it, and how to live a very successful life, even if you might have bipolar disorder. You can take a look at my website for more information at bipolarlosangeles.net. That's bipolarlosangeles.net. You can also see my book coming out in 2012 called Beating Bipolar, and it should have some great information and knowledge to help educate you. And you can also reach my office at 213-304-9555, 213-304-9555, and I offer consultations to help people with bipolar. So thanks for watching this video, and I hope this explained a little bit more of what bipolar disorder is, and I hope to see you soon. Thanks.